Certainly. Here's a detailed and comprehensive explanation of right bundle branch block, RBBB, based on the structure you provided. Number 1. Introduction. Right bundle branch block, RBBB, is a type of cardiac conduction abnormality where the electrical signals in the heart are delayed or blocked in the right bundle branch of the heart's conduction system. This condition is typically identified through an electrocardiogram, ECG, and can be benign or a marker of underlying cardiac disease. It may not cause symptoms, but requires evaluation to rule out other heart conditions, especially in symptomatic patients. 2. Definition. RBBB is defined as a delay or obstruction in the transmission of electrical impulses from the atrioventricular node to the right ventricle, due to dysfunction in the right bundle branch of the bundle of His. This causes the right ventricle to contract later than the left, resulting in a distinctive pattern on the ECG, including a widened QRS complex, 120 milliseconds. 3. Etymology. Right refers to the right side of the heart. Bundle indicates the bundle of His, a part of the electrical conduction system. Branch, a division of the bundle into right and left pathways. Block suggests interruption or delay in the normal conduction pathway. 4. Epidemiology. Incidence. RBBB occurs in around 0.2 to 1% of the general population. Age-related, the likelihood increases with age, often seen in individuals above 50 years. Gender. More common in males than females. Comorbidities. Frequently associated with cardiopulmonary diseases, including coronary artery disease, pulmonary embolism, and congenital heart defects. 5. Types 1. Complete RBBB. Full blockage in the right bundle branch. QRS duration 120 milliseconds on ECG. Classic RSR pattern in V1. Incomplete RBBB. Partial delay. QRS duration between 100 to 119 milliseconds. ECG findings similar to complete RBBB but less pronounced. 6. Causes. Idiopathic, no identifiable cause. Coronary artery disease, CAD. Myocardial infarction. Congenital heart diseases, e.g. atrial septal defect. Myocarditis. Pulmonary embolism. Right ventricular hypertrophy. Hypertension. Trauma or cardiac surgery. Chronic obstructive pulmonary disease, COPD. 7. Risk factors. Advanced age. History of heart attack. Congenital heart abnormalities. Pulmonary hypertension. Chronic lung diseases, e.g. COPD. Heart failure, high blood pressure, diabetes mellitus, previous cardiac procedures. 8. Complications may signify underlying heart disease, increased risk of complete heart block, potential development of arrhythmias, syncope or dizziness due to reduced cardiac output, challenges in ECG interpretation in myocardial infarction. In symptomatic individuals, risk of sudden cardiac arrest increases if other cardiac pathology is present. 9. Pathophysiology. Step by step. 1. The sinoatrial SA node generates an impulse. 2. The impulse travels through the atria causing atrial contraction. 3. It reaches the atrioventricular AV node, then the bundle of His. 4. The bundle of His bifurcates into left bundle branch, normal conduction, right bundle branch, blocked or delayed in RBBB. 5. Due to the block in the right bundle, the impulse cannot directly reach the right ventricle. 6. Instead, the right ventricle is activated indirectly via cell-to-cell transmission from the left ventricle. 7. This delayed depolarization of the right ventricle results in prolonged QRS complex on ECG, RSR pattern in V1, and wide S waves in leads I, AVL V6. 10. Signs and symptoms. Often asymptomatic, especially in isolated RBBB. If symptomatic, palpitations, fatigue, lightheadedness, shortness of breath, dizziness, syncope. In rare, severe cases, symptoms usually relate to the underlying cause, not RBBB itself. 11. Diagnosis. 1. Electrocardiogram, ECG. Findings. QRS 220 meniscus, RSR or RSR pattern in lead V1, broad or slurred S wave in leads I, V5, V6. 2. Echocardiography, to assess structural or functional heart disease. 3. Holter monitor for intermittent blocks or symptoms. 4. Stress testing, if ischemia is suspected. 5. Cardiac MRI CT. Advanced imaging in case of suspected congenital abnormalities. 12. Nursing diagnosis. Decreased cardiac output related to ineffective conduction. Risk for activity intolerance due to impaired perfusion. Anxiety related to new diagnosis. Knowledge deficit about condition and management. Risk for falls if associated with syncope or dizziness. 13. Medical management. Asymptomatic cases may require no treatment. Manage underlying cause, e.g. myocardial infarction, pulmonary embolism, beta blockers, ACE inhibitors, or diuretics if associated heart failure is present. Antiarrhythmic drugs if there are concurrent arrhythmias. Pacemaker insertion if associated with symptomatic bradycardia, complete heart block, syncope with underlying conduction delay. Number 14, nursing management. Monitor ECG and recognize signs of progression. Assess vital signs, oxygenation, and perfusion. Educate the patient on RBBB and its implications. Encourage adherence to medications. Support lifestyle changes, diet, smoking cessation, exercise. Monitor for signs of heart failure, e.g. edema, dyspnea. Provide emotional support and reduce anxiety. Number 15. Treatment options. Observation and reassurance for isolated asymptomatic RBBB. Treatment of underlying disease, e.g. coronary artery disease, pulmonary embolism, pacemaker implantation in severe conduction abnormalities, antiarrhythmic medication if arrhythmias occur. Lifestyle modifications, low-sodium diet, regular exercise, smoking alcohol cessation, weight control, oxygen therapy if respiratory disorders contribute. Number 16. 5 psychosocial interventions. 1. Cognitive behavioral therapy, CBT, to manage anxiety related to cardiac symptoms. 2. Patient counseling about the nature of RBBB and its prognosis. 3. Support groups for patients with heart rhythm disorders to share experiences. 4. Stress reduction techniques, such as meditation, yoga, or relaxation training. 5. Educational programs, empowering patients to take control of their cardiovascular health. Number 17, prevention. Manage risk factors, control blood pressure, diabetes, and cholesterol. Avoid tobacco and alcohol. Regular cardiovascular checkups, especially with family history. Prompt treatment of cardiac or pulmonary conditions. Heart-healthy lifestyle, balanced diet, DASH or Mediterranean, physical activity, stress management. Number 18. Conclusion, right bundle branch block is a conduction abnormality often detected incidentally and is usually benign in isolation. However, it can be a marker of more serious heart or lung conditions. Accurate diagnosis through ECG and clinical evaluation is essential. Management depends on symptoms and underlying pathology, with treatment focusing on supportive care, lifestyle modification, and intervention when warranted. Nursing care plays a crucial role in monitoring, educating, and supporting affected individuals. Thank you. Have a nice day.